so great to have you guys here today. I wanted to learn more about the impact of your work within the healthcare industry, as well as the challenges that you guys face in your roles. So I don't know if you guys can tell me a bit more.
I'm Shauna Gish. I work at UnitedHealth which is a part of UnitedHealth Group, and I have the privilege of working with our Medicaid population, which largely consists of moms and babies. And so I get really passionate about this topic. I'm the kind of person that needs to find meaning in my work. When I love what I do, I actually work better. I work faster, I remember things, I can innovate. So my career here at UnitedHealth Group has allowed me to do that. Unfortunately, the United States has one of the worst premature birth rates of any developed country. In fact, recently it's risen to almost 10%. So we've developed a program for group prenatal care. One of the great things that enables is a support community where mothers that are all expecting can get tips about nutrition, exercise, how to find time for themselves. The reason that we're doing this is that external studies have shown that it can reduce the prematurity birth rate by up to 33%.
I'm Dr. Nicole Cooper. I have the opportunity to lead the UnitedHealthcare Social Responsibility Team, a team focused on improving UnitedHealthcare's investments in local communities. So one of the health challenges that I get to address is expanding access to dental care in a state like Arizona. In one community, 2/3 of third graders have tooth decay. To combat this issue, we started funding mobile dental clinics that they take to schools to serve children in their community-based settings. And in that community, the mobile dental clinic that we fund will continue serving thousands of children for the next few years.
Wow, those are great initiatives. I think we're facing similar issues in our global markets with new populations that want better access and affordability in their healthcare. So talking about all this really gets me passionate about healthcare, and I really wanted to know, Nicole, what drives you and what's your personal connection to healthcare?
So my work is deeply personal to me because of my family's experience in navigating the U.S. healthcare safety net. I also previously worked in national health policy before I joined the company and was working to reform the U.S. healthcare system to better serve vulnerable communities.
Well, I'm actually a mom myself, and so I get really passionate about looking for ways to help moms as they're going through a really exciting but also sometimes difficult part of their lives.
I actually started off as a pre-med student myself, and I think when I realized that direct patient care wasn't the only way you could make impact in the healthcare system, I got really fascinated with healthcare policy. I think it's really important that healthcare is affordable for everybody.
I love that our company has a really clear mission that its people and its leaders relate to. So my career here at UnitedHealth Group has allowed me to connect to something that feels bigger and more meaningful than I do alone.
I love that. I do think about when I come to work every day, I get to move the mission forward. And so I think about the work that I was able to do before I came to UnitedHealth Group and how my current role expands that commitment and that purpose for me personally.
I've met a lot of people that have built their lifelong career here, and I think that's something that really drives me, is seeing all the opportunities to develop myself and also work with experts in the healthcare ecosystem. And that's why I'm compelled to make as long as a career here as possible at UnitedHealth Group.
It's not true. Not the rest of their lives.